Hello and welcome. I am Dr. Dolores White, and I have the pleasure of serving as the president for the KNA. I want to thank everybody for attending the KNA Town Hall tonight and for the River City chapter for hosting this event. Thank you to the Governmental Affairs Cabinet for planning and holding the town halls this month across the state. This is our first one this year. And a special thank you to all of the legislators here tonight. We truly appreciate you attending and for your support. We know how busy you are, so thank you for being here. Just want to share that KNA represents and speaks for 90,000 voting Kentucky nurses who make up 53.3% of the healthcare workforce. And we want you to know that we encourage you to please contact us at any time if you need information or assistance. We would be happy to serve as a resource for you if you have health or healthcare questions. As you are planning your legislative actions, we are here for you and we're happy to assist. So now I'm going to turn it over to Delanor Manson, our KNA CEO, who is going to review the agenda and the guidelines for the evening.
I would like to also echo our welcome to those individuals who are with us today as attendees, but also the legislators who took the time to be with us. I want to go over a couple of guidelines for the town hall and review the agenda. We will allow you and encourage you to take 2 minutes to introduce yourselves in just a few minutes. And my real job is that I'm the person with the hook. So with your 2 minutes, or even when you're doing or providing answers to questions, when you get to 30 seconds, I will put up a finger. When you get to 15 seconds, I will put up 2 fingers. When you get to the end of your time, I will mute you. I am the hook person. I also wanted to just review the rest of the agenda. After the introductions, then April is going to talk about our success in 2022 and then discuss what we hope that we will have as a successful legislative session for 2023 priorities. And then we'll have some questions and hopefully you'll give us a lot of answers. We will encourage the individuals who are attending to put their questions in the chat box. And then we will answer those at the end, and I will be monitoring those questions. So at this point, I would like to get started and let's do introductions. And you met Dolores White. I didn't introduce myself. I'm Delanor Manson. I'm the CEO for the Kentucky Nurses Association, the Kentucky Nurses Foundation, and the Kentucky Nurses Action Coalition. And I've been the CEO for 6 years. I just had my anniversary on September the 5th, and I'm delighted to be with you. Julie, would you introduce yourself?
Sure. I'm Julie Denton. I am the external lobbyist for the Kentucky Nurses Association.
April? You're on mute.
Sorry, I apologize. I am April Hester. I'm a certified registered nurse anesthetist, and I am the chair of the Governmental Affairs Cabinet within KNA.
Outstanding. Renee.
Good evening, everyone. I'm Renee Cecil. I am the chair of the River City chapter. Lots of words there, but I definitely am so excited for everybody to be here. You know, as Dolores mentioned, we are the experts in healthcare. So I think this is awesome that KNA allows us to connect with those that will represent our community. So thanks for having us.
Excellent. And Renee's chapter is the second largest chapter in Kentucky with over 600 nurses. Excuse me, I am so sorry. Over 600 nurses in the River City chapter. Senator Cassie Chambers Armstrong, would you introduce yourself?
Sure. I'm Cassie Chambers Armstrong. I represent District 19 out of Louisville. That's the district that Morgan McGarvey represented before he went to the United States Congress. Very excited to be here with you all. I serve on the Health Services Committee, and so have some familiarity with the great work of the KNA and have gotten to meet some of you, but really excited to get to learn more about your priorities and be here with you this evening.
Thank you. Senator Berg, I will leave you to last if you like. Senator Lindsay Tishner, would you introduce yourself?
Yes, trying to get my camera back up. Is it working? I
It
don't know if it is
is.
or not.
It
Okay,
is.
great. I have no
Working.
idea what I
Thank
look like
you.
because I can't see it.
You're looking good. You're looking good.
Oh, thank you so much. So, I'm the senator from Oldham County. I represent District 6, which is Oldham, Trimble, and Northeast Jefferson County. I serve on Education, Family, and Children, and Health Services. And I'm looking forward to being with you guys tonight. I can stay until about 6:45, but I'm looking forward to hearing what's going on with the KNA and all of your all's priorities for the next session.
Thank you. Senator Deenan? He's driving as well, by the way.
Yes, I can hear you.
Okay,
I
great.
am. I'm Senator Matt Deneen. I'm from the 10th District, which is all of Hardin County and a little part of Southern Jefferson County. Although I'm not on a health committee, I am on the A&R budget committee, and also the veterans, co-chair of the Veterans Committee, and it deals with public protection. And so in a roundabout way, I guess I can be a voice in those areas. I'm glad to be here, but I won't be able to stay for very long. I was thinking it would start at 5:30, and I've got just about maybe about 15 or 20 minutes, and then I've got to sign off. So, but I do want to thank you all for having me, and I look forward to seeing the legislative priorities that come out of this.
Thank you so much. Senator Burke, are you available?
I am. Can you hear me okay?
Yes, thank you.
All right. Thank you. Karen Berg, Senator Berg, District 26. Used to be Northeast Jefferson County and the entirety of Oldham, but now I'm inside of Jefferson County in a backward C as you go along the right side of the city, basically, is how I describe it. I do sit on health services, and both my mother and my sister are nurses, so very, very near and dear to my heart. So I'm very happy to be here, and thank you for inviting me.
Thank you. All right. At this time, I'm going to turn it over to April Hester, who's going to talk about our priorities in 2022 and 2023.
Again, I just want to say thank you all for spending your time with us this afternoon. We're both excited and appreciative that you're here, both the members and the senators that came out this afternoon. We hope this is helpful to both of you as members and as senators, and to see our legislative priorities. I'm sure you all know there are nurses in every legislative district within our state. So some of the constituents might be with us tonight, and we're looking forward to hearing from you guys. Each year, the Kentucky Nurses Association works to improve not only nurses, but overall healthcare policy within our state. We do this by volunteering, workforce data collection, nurse emeritus programs, collaborating with other healthcare and professional organizations within our state, and setting forth legislative priorities for our legislative sessions. These sessions and these priorities are based upon information review and sharing, evidence-based practice, and policy-driven research. These priorities are brought to KNA not only by the aforementioned things, but also as individuals, whether it be a nurse, a legislator, or just a private citizen. Year-round, the KNA accepts requests for proposals for legislative priorities or concerns on a form that you can submit on the KNA website under the advocacy link. I would like to take a moment to thank each of you all for the support of last year's KNA legislative agenda for workplace safety, which was House Bill 176. There's a bit of data that kind of demonstrates what's important, that the importance of this law. And about 48% of nurses have reported workplace violence. And over half of those that have reported has also reported injury from those violences. So thank you again. Kentucky has become the 40th state to enact some form of workplace violence legislation. We applaud the General Assembly for increasing the safety for all healthcare providers, not only nurses, within our great state, and indirectly addressing the nursing shortage. Last session, we also supported House Bill 200, which was establishing a fund to address the healthcare workforce shortage. Again, not only nurses, but all healthcare providers. As you know, Kentucky, as well as the entire United States, has a critical nursing shortage of approximately 36%, or two-thirds. To give another perspective, that's about 20,000 nurses short if we continue along this path by the year 2025. KNA wants to partner with the General Assembly to implement creative strategies to address these shortages. At this time, Kentucky Nurses Association has two legislative priorities for the 2024 session. The first is decriminalization of medical errors. In a few states, nurses and physicians as well have been criminally charged for what were just errors, not intentional medical errors, providing care for our patients. We don't want to deter folks from entering the most trusted profession, nursing, nor other healthcare professions. So we feel like this is important. We don't want nurses to leave this profession. Representative Jason Nemes is the sponsor of this bill, and we have had talks with him and a couple of the interim IJC committees. Our second bill for the session is Sorry, my light died. I apologize. I didn't mean to give anybody a seizure. Our second bill for the session addresses safe staffing committees and facilities. We are not talking about ratios. We want to make that clear, no ratios. Instead, we want a nurse-driven, safe staffing committees within our facilities that take into account patient acuity and a need, as well as other factors. Stress and burnout are big contributors that lead to nurses leaving the profession. This bill will give them a voice in decision-making with regards to safe staffing and enable them to better care for their patients, and another tool in the toolbox to retain nurses and address that shortage I was speaking about. KNA supports a number of other issues dealing with recruitment and retention, nurse emeritus programs, making the workplace safer, as in the workplace safety, and less stressful, and measures that would make nursing a more overall appealing career. In addition, we are looking as to how to ensure all schools have a nurse all day, every day. We hope to be able to provide you more information on that at a later date, as we are doing a lot of data collection in that field. Now we'd like to give you the opportunity to share your thoughts on the important issue to Kentucky nurses. Our lobbyist, Julie Denton, and I will take turns asking some questions back and forth to each of you. You will have 3 minutes to respond. If you need any clarification prior to answer, please ask. Delano will be a stickler for the time restraints.
Do you want to go first, April, or would you like for me?
I can, it doesn't matter. So let's jump right into this. I'd like to ask, what are the issues you see in healthcare related specifically to nurses that you think should be addressed, and how do you think we should address those?
Let's start with Senator Armstrong. Would you like to
Yeah.
give us your thoughts, please?
Yeah, I'm happy to go first. And thank you all for sharing your priorities. And I do want to say thank you for the work that you all do. My background is in public health, and I had the opportunity in that to learn from and get to know a lot of amazing nurses. And so I know that I will never understand exactly how challenging and important the work you do is, but I like to think that I have a little bit of a flavor of it, and I'm very grateful for it. So I am really concerned about the nursing shortage, the numbers that you all just put out. I know that we have taken some steps around making sure that we are providing increased funding for training and educational opportunities. I think that there's probably some more work to be done there to make sure that we're providing educational opportunities, training programs, scholarships, loan forgiveness. I saw one state that allows for a tax credit. If you're in nursing, you're just on your taxes, get to claim it. If you're in a rural area, you get to claim even more, or working in an underserved community. I think policies that improve working conditions, the fact that so many nurses have experienced workplace violence is just really, it's concerning to me. It makes me feel really sad that you're doing such important work in conditions that don't always make you feel safe and appreciated. And so, working on I know that we have done some things around workplace violence. I think there's more work to do there. Making sure that we're offering those competitive salaries, that we're continuing to ensure those career growth opportunities, that we're doing what we can to make nursing an attractive profession, and making sure that you all feel the respect from the community, from us as legislators, that you deserve. I'm very interested. I think decriminalizing errors. I'm a law professor, and so I teach about how we don't criminalize mistakes. That's actually what I teach law students every day, is that there's a difference between a civil liability for a mistake and charging someone with a crime. And we reserve crimes for those intentional sort of things that someone actually meant to do something wrong. And so that makes a lot of sense to me. And then looking at making sure that we address the staffing piece as well, like you all were talking about. I think that's part of making sure it's an attractive profession that people want to be in. And so it sounds like you all have done a lot of good work around being thoughtful around what a Kentucky specific solution and a Kentucky sensitive solution would look like. And so I'm really excited to learn more and partner with you around that.
Thank you, Senator Deneen. You're on mute. We can't hear.
All right, how about that? Does that work? There we go.
Yes.
Recently, I do agree that one of the major concerns is staffing. And we are seeing such a shortage, not only in nursing, but in several fields of professional areas. So, but the nursing shortage in particularly, I have seen that ripple effect all the way into the work I've been doing with veterans and military affairs at our veteran centers. And the disparity there in the number of nurses that we have there, the shortage has really affected revenue that could be coming into the Commonwealth if we had the nurses, the numbers of nurses we need in these veteran centers. We would not have a waiting list to get in. We have several beds in our veteran centers that are, they're empty, and they're empty because we don't have nurses there to provide the services needed. So I'm working right now on trying to fix that. I have looked into the lottery task force funding of specific areas and workforce development. So I've also looked at our high school pathways in nursing here locally in my district with Elizabethtown Community College, and the expansion of EC3 and their nursing facilities there for training. So I'm open to a lot of other avenues, but the disparity in pay, I think, is between those that are working in our veteran centers, those that are working in our hospitals, and those that are traveling nurses is it's a wide margin. And I think we have to do better there to try to close that gap. So I won't be able to stay for any other questions tonight, but I do want to thank you all for having me, and I look forward to getting some notes here from you all for the rest of this evening.
Thank you very much. We greatly appreciate your time. I know it's hard to be in 10 places at once, and you get pulled into a lot of different directions. So thank you.
Well, good luck.
Sorry. Go ahead. Okay, I guess he's gone. Senator Tishner, would you like to
are you
answer the
asking me? Am I
question?
on? Yes.
You're on.
Sure. So I have had the wonderful, horrible actual pleasure of of spending a lot of time in the hospital this summer. My dad has been in since, well, pretty much all summer. So I've been able to kind of see up front and personal some of the issues that have affected his care and have affected the nurses that were caring for him. One of the things that the traveling nurse issue is something that has assisted in the shortage in a beneficial way to some extent, but it has also left some gaps in regards to continuity of care. And I don't think that benefits the patient or the nurse in those situations. So I want to really look at that. I got to sit down with the CEO of University of Louisville Hospital while we were there and just kind of discussed a little bit about traveling nurses and how that's affected his hospital system. And so that's kind of rolling around in my brain for next legislative session. I can't say that I know what the solution is going to be for that. I know it's become a really popular thing in the last few years since COVID. And I think there's some ways we can make sure that it continues to be beneficial in the ways that it can be, but also to make sure we're protecting nurses and making sure the best care. Personal watch happened in the healthcare industry that I think probably has contributed to the workforce shortage in regards to COVID policy needs to be addressed. We need to look at that. There were a lot of nurses who felt pushed out, and maybe not a lot on this call, but I'm speaking for people that I know are also potential nurses who hoped to get into the profession and have found it very challenging because some of those policies are still in existence and there's not a lot of wiggle room there. So those are some of the issues that I think would warrant further discussion with all of the KNA Association. And yeah, I look forward to having those conversations a little bit further.
Great, thank you. Senator Berg?
I am here. I don't know if you all can see me or hear me, but hopefully you can.
We can.
Okay, great. You know, honestly, I have a question and not so much of an answer. Why no quotas? I mean, I think that addressing the fact that nurses are being put in positions where they cannot adequately care for the number of patients that they are responsible for is an issue and needs to be addressed. So I guess my question is, what did we find wrong with quotas as far as, given the intensity of the patient, ICU patients, surgical post-op patients, with that type of thing. But so I'm a little bit concerned about that. As far as my priorities for nursing, it is to make sure that anybody in this state who wants to get the education to be a nurse in this state has that opportunity. And not only is that opportunity made available to them, but they are made aware of the fact that this opportunity exists for them. We have so many young people in this state that aren't to the point where they know how to dream for themselves. They really have to understand that we have professions. We can help you get educated. We can get you a good job. We can start you on your life to being a successful, contributing adult. And this is one of the best ways to do it. This is an awesome profession that pays adequately and people are needed. And it's open to anybody. So that's my message. We have to get nurses, we have to train them, and then we have to keep them. We have to make the workplace to the point where people want to and will stay in the profession. You cannot drive them away. You cannot have, workplace violence and angry patients and patients insisting that they be treated with, it goes on and on and on. So anyhow, I'm going to quit talking. Somebody's supposed to be raising a finger, but I do have that question. Why are we backing away from quotas?
April? I would be glad to answer that question for the senator, if that's okay.
Sure,
Um,
go right ahead.
Senator Berg, we are not backing away from quotas, but what we know and what studies show is that ratios don't fix the staffing shortage, and it doesn't meet the needs of patients. And what we mean by that is we know that based on the skill set of a nurse and the needs of the patient is how the staffing should be focused. It should not be focused on a number. So if you have a nurse who has 5 patients, and those 5 patients are really heavy patients, then that doesn't meet the needs of the patients. Or there are patients, one patient that can take one nurse to take care of them, or 2 nurses. What we're saying is our focus is on what does the patient need and what does the nurse have to give in terms of skill set and time and availability. So it's not like we're saying that ratios, they just don't work based on the needs of the patients. And so when you focus on a number, you miss the piece about what the patient really needs. We want to look at the acuity of the patient and the skill set of the nurse.
And I'm going to actually further elaborate, Delano. I think you did a great job at explaining that. It's not about quotas. It's about looking at the entire picture. It's about taking individuals that take care of patients on a 12-hour basis, that spend 12 hours to 13 hours to 14 hours with that patient, putting them on a committee, and them taking to the individuals in administration and telling them this patient needs A, B, C, and D. I think sometimes, and I might regret saying this, I think there's a disconnect between clinical nursing and what administration sees and does. And I think it's important to have a all-encompassing team to take care of one individual.
Interesting.
I'm
Thank you.
good with that. I think that that's an excellent way to follow up on patient needs and staff skill set to offer to take care of those patients. Okay.
Thank
Did
you.
we have an opportunity for everyone to respond, Julie?
Yes, we did, unless I can't count, which is altogether
No,
possible.
No, you don't count. Okay, so we want to go to question number 2.
Sure. The nursing shortage is a critical issue in Kentucky as well as nationally. And I think some of you all have hit on these points already. But what additional measures do you believe could be taken to address this issue?
Do you want me to go first again, or would you like to rotate it?
I'll tell you, let's rotate so you don't always have to be in the hopper at first up. How about Senator Tishner? Would you like to go first?
Yeah, I think it would be important to find out why. Why is there a shortage? Are people leaving the profession more than they're coming into the profession? Are we maintaining our nurses already in the profession and just not drawing new in, and the need is rising? So what is really contributing to it? And honestly, I like to look at the data and see when did this trend start? Did we start in 2015? Did we start in 2020? What event could have happened that might have drawn people out of the profession, and try to pinpoint that. And in order to address it, I think obviously try to pinpoint the source of why they're leaving or why they're not coming. But really to put efforts into vocational training in high schools. We have a phenomenal program in Oldham County. I know Shelby County, Carroll County. There's so many great state-run vocational schools, and also county-run vocational schools that really focus on the nursing profession and the healthcare profession in general. And they just have some great programs. So how can we recruit at an earlier stage at that high school level, and maybe getting kids involved even at a younger age to start talking about what it means to be a nurse? Have we gotten away from that? That goes back to my first point. Was there ever a point in the last several years that we've stopped recruiting and bringing in a nurse for the day to come and talk to students and talk to elementary schools and really lay out how great it could be to be a nurse. So I think those are just some simple things. I don't know that there's a quick fix to it to flip the switch and turn it around, but addressing and finding out exactly what has led to it, I think, is important. I know I can tell you just one of my constituents has been reaching out to me continually. Her daughter is in nursing school right now. And boy, she is just getting raked over the coals because she won't take that COVID vaccine. And I think we need to really look at that. And if we're going to allow exemptions, we need to do that, and to not make it more difficult for someone who wants to be a nurse, but also wants to make that decision for themselves. So if that's an issue, like it within our nursing schools, let's not close those doors for people who are interested in being nurses. Let's make it open the doors and make it easier for them to be able to come into the profession and not feel pressured or treated differently, and especially in that way.
Thank you. Senator
Julie,
Burke?
Julie,
Yeah.
would you mind if Dolores responded to a couple of the comments that Senator Tishner, she asked a few questions, and I think it would be good to have some answers at this point while she's asking those questions.
Sure.
Okay, absolutely. The one that comes to mind for me is the vaccinations with nursing schools and the need for that. Now, I could tell you that nursing schools follow the guidelines that are set forth by the CDC, but then also as far as the vaccination, it's the policy for the organizations where students are going for their clinicals as well. So organizations that are still requiring vaccination, if our students are going there, then we have to ensure that the students have those vaccinations in place, as well as the entire list of healthcare needs. So that's the guidelines that we follow. So it must be the person you talk to where that student is going to clinical, that organization is still requiring it. Some organizations do have where they can decline that, but again, the schools of nursing have to follow the organization and their policy and protocols. And I'm sorry, was there another question, Delanor, you needed me to add additional information?
No, that was the primary question. Yes. That I thought that with your expertise and with you being a professor, that you would be able to provide that support.
Sure, absolutely, absolutely. Mm-hmm.
Senator Tishner, did that answer your question?
Oh, there was one other thing.
Sure.
When did this start? We've always had a nursing shortage. Yeah. Let me just tell you, it did not start with COVID. It's not going to end with COVID. The problem is that nurses are, the average age of a nurse in the state of Kentucky is 52. And while nurses work in many places, 43% of all the nurses in Kentucky work in hospitals. That is hard work for a 52-year-old person. So the other thing is we need to really focus on retaining. A lot of the bills have really focused on the pipeline and getting people in. In reality, it takes 3 to 5 years for a nurse to get out of nursing school and then to be competent to take care of patients. So if we don't focus on retention of nurses, then we are behind the 8 ball. And that is a terrible place to be.
Great. Thank you so much. Okay, Senator Burke.
I'm here. I don't know that I have a whole lot more to offer. I will say that we seem to, as a society, be having problems filling some of the roles that were traditionally filled by women. Mm-hmm. Teachers and nurses in particular are 2 roles that are essential to society that we're really having trouble recruiting and retaining. And it goes back, guys, to the history of these jobs. These were jobs that were underpaid and essentially were being done because people cared enough to actually want to do the work and weren't so focused on how much they were being reimbursed. And now, life isn't like that anymore. Most families need the income of both adults. So we have to make these jobs honestly more equitable. They have to be, nurses needed to be treated with more respect. They need their position in the healthcare hierarchy to be, I don't know how to explain it. It needs not to be women working for men anymore, which historically is what it was. And we have to fix that if we're going to fix, in my opinion, both of these professions, both teaching and nursing, which do not need to be female professions. Men can do these jobs just as well, possibly, maybe, sometimes better. But we have to change these roles so that people want to do this job and feel like they are being appreciated for the very, very difficult work that they're actually doing.
Thank you.
Thank you very much. We appreciate that. Senator Armstrong?
Great, thank you. I'll try not to repeat the great comments that other folks have made. I think, like I said before, we need to use every tool that we have. I think if there were an easy lever that states could push to solve the nursing shortage and all of these issues, someone somewhere would have pushed that button by now. And instead, it's about figuring out what the right combination of tools are. And I know we have started to take some of those out of the box and put them to use. One thing I worry about in government is if we don't monitor the results closely enough. I think sometimes it's very easy to say, well, we did something on that. We passed a bill on that. We've addressed that issue without making sure that we're constantly monitoring to make sure that what we did is working and that it's going far enough. And if we need to do more, making sure that we don't sort of get in that headspace of like, well, we already did something over there. The other thing that I think is important is continuing to work with folks who have the best perspective and most sort of lived experience in this area. And so that's why I'm really glad to be here tonight and hopeful that we can keep the lines of communication open. Policy is best whenever you have the people who are most directly impacted and with the most expertise being the people with the seat front and center at the head of the table. And so I think when we're talking about how we solve these problems, it's keeping an open mind, it's keeping everything on the table, it's constantly monitoring, and it's making sure that those channels of communication are open. And so glad to have opportunities like this one and hope we have more like them in the future.
Great, thank you so much. And Senator Neal, thank you for joining us. You bring a bow tie to the table tonight, and we always appreciate your bow tie. And I'll repeat the question for you just since you're last answering it. Plus, I'm not sure if you heard when it was first asked, but the nursing shortage is a critical issue in Kentucky as well as nationally. What additional measures do you believe could be taken to address this? I can't hear you. You
I
must
think
be
you're
on mute.
Mm-hmm.
I think you're on mute.
Are you on your phone, sir? Nod your head for us. Yes. So
Okay.
click your phone and there's a button at the very bottom left-hand corner that has a microphone. Click the microphone. Somebody else want to try?
A host might be able to force unmute him.
Oh, yeah.
I'm trying.
Right.
I'm trying. And I'm trying because I really want to hear what Senator Neal has to say. He always has sage wisdom.
Well, I see he sent me a text that he's been trying to get in. And so now he's finally gotten in, but now
we can't hear him. Yeah, I've
my lip reading is so rusty.
Well, I have tried to unmute him from the host position, but have not been successful.
Well, you keep working on that and we'll come back to you, Senator Neal.
Yeah, but don't leave us.
You and Delano can work on this together, and April can just go to the third question and we'll back to you.
So our third question is based upon the Kentucky Nurses Association priorities of decriminalization of medical errors and safe staffing committees. What are your thoughts on these, or do you have any questions for us about these?
Let's start with Senator Berg this time.
I'm here. I don't think I have significant questions. I will be honest. When this medical error bill was presented, I did question the need for it. I know that apparently there was a case, I do believe it was down in Tennessee, correct me if I'm wrong, that prompted the feel for the need of this legislation. But as Senator Armstrong was saying, legally, there's a difference between a mistake and an intentional act, either of omission or commission. And we haven't had any lawsuits in this state brought against any healthcare providers for an actual mistake. So, if it makes people more comfortable, I don't really have a problem with it. I think it may not honestly be necessary. I mean, as far as staffing, I think it's absolutely essential for patient safety and for our nurses to make sure that they are in a situation that they feel that they can offer the care that their patients need and not put themselves at risk. And believe me, I know what it's like to be working in a situation in a hospital under very, very trying circumstances and not have enough manpower, and know that you are not doing the job that you could be doing and that you should be doing because of the situation that you're being put in. And that should not happen. That should not happen to people when your job has to do with the health and integrity of other actual living human beings. So anything that we can do as a legislator to support nurses and other healthcare personnel to make sure that they are not being forced into positions that are unsafe for them, unsafe for the profession, and unsafe for their patients.
Thank you. Senator Armstrong?
Yeah, I think the only question that I had was related to what Senator Berg was just saying about understanding if there have been cases or threatened prosecutions or anything like that resulting from medical mistakes, because in my reading of the law, at least as I teach my law students, maybe I might need to teach them some different things. I teach at the University of Louisville Law School, and I would hope that our law recognizes that, again, mistakes and unintentional acts aren't subject to criminal liability. It's those intentional and those culpable and those highly, highly reckless things. So I would be interested in the future just in understanding more if it was just this one case where maybe, I don't know if it was facts or state specific law or what happened, but I'd be interested in learning a little bit more about that. But overall, I think you all have done an excellent job of sort of educating us on your priorities. I know that there is always more to drill down on. And so I'd love to see specifically some of the details around the safe staffing proposals and what it would look like, and have a further conversation with you all, just so I can understand how to be an advocate for that. So it's a very important issue, and I want to make sure that I am understanding so that I can articulate to people and help explain and champion that. But I don't have any other questions right now. If I do, I know how to reach you all. And if you all have questions, you all know how to reach me.
Great. Thank you so much. And it's really nice that, being a law professor, that you understand the concept of the decriminalization of medical errors. And I think from the K&A perspective, we're looking at that not just from a recruitment aspect, but also a retention. And there have been a couple other states in the past who've also had situations like this where nurses have been charged criminally for a medical error. And so,
And to elaborate, oh, go ahead, Julie. Sorry.
Yeah. Oh, go ahead, April. Go
To
ahead.
elaborate and expand a little bit, this is common law. This doesn't change what is in common law. This isn't talking about tort reform or anything of the aspect. This just shears up what is in statute to regulate, or regulation into statute. And there has been 3 other states in regards to criminalization of a healthcare provider, not only a nurse, but as a physician as well. So we're just trying to prevent an issue before it happens.
Exactly. Thank
I
you.
appreciate the context.
Senator Tishner.
Okay, I'm going to show my ignorance a little bit here. Do nurses have like an E&O insurance, or are they covered in some way that would already protect them from these types of errors?
We have medical malpractice, so that
Okay.
would prevent us from being sued civilly. But did I say that? Julie, help me out here.
Well, it
Not-
covers you just like it does a physician with malpractice insurance, but that only goes so far.
Civilly
And
covers
not every-
us.
Not
Civ-
every nurse has malpractice insurance. Many nurses depend on their employers to protect them, but in reality, I would say probably close to 60% of nurses do not have malpractice or liability insurance.
So this could be something that could protect them, for those especially that don't have that type of coverage. I think, for both this and the safe staffing, so much of legislation is in, just defining things correctly and making sure errors is defined, and what constitutes safety and staffing. Because I mean, we had some rough nights with my dad when the sundowners thing, and he turned into a not safe patient, and I was in the middle of that and got to see it firsthand. So just making sure those definitions are really well thought out and take into consideration the patients who might not necessarily be unsafe patients, but may behave in that way. And 2, I think, one of the things that we came up against was just, especially on those night shifts, not having a CNA. And I imagine with the nursing shortage, there's a CNA shortage as well. So just, that's again, that workplace, or workforce shortage that we see across the healthcare industry that we need to look at and consider, making sure if we're going to have safe staffing, that we have enough staffing to protect everybody in that kind of situation. So, but I look forward to reading both of these bills. And I know with Jason Nemeth, I think, is covering the decriminalization of errors. I think he'll think that through really well, and I'm sure you guys will guide him through verbiage on that. Do you know who's going to cover the safe staffing legislation that you guys are talking about?
We've got a couple of legislators who've talked to us about it, and so I don't want to. It's still being decided.
Okay.
Thanks. Senator Neal, well, before we go to Senator Neal, let me just say that if anybody in the audience has a question you'd like to submit, not all questions will be asked, but if you've got some questions you'd like to submit to be asked, please do so with that in the chat box. Senator Neal, have you made any progress on unmuting? Dang it. You have the same problems with technology I have.
He could marry his tech person too. Senator Neal, at the top of your screen on the right-hand side, there should be a microphone that has a cross through it, a red cross. If you can see that and you can tap that, it will release that cross so that you will be able to speak. He doesn't see that. Okay.
Well,
Tap your
I
screen.
know how we do the right thing.
Tap your screen once. Oh, he's so cute.
He loved that. Well, don't worry about it. We understand and we appreciate you being here. At least you're able to hear the conversation, and we'll have more conversations with you in the future to talk about these issues and get your input as well. Thank you.
Did we
Senator,
have
Senator Tishner needs to hop off. But before she goes, I wanted to, but do I have time to answer a question quickly for you, Senator? Yes.
Sure.
Okay.
Yeah.
All right. You had asked a question about are we aware of the data about why nurses are leaving and why we can't get nurses in? In October of 2021, the KNA released a survey to the nurses, and nurses from all stratospheres answered that question. We're talking school nurses, professors, hospital nurses, long-term care, corrections, home care, hospice. And what they told us was, we're tired. We don't have enough staff, and we don't have time to even go to the bathroom because there's nobody to take care of our patients if we have to go to the bathroom. And so they needed to have more staff to be able to take breaks. But they also said they were going to be leaving the profession soon, because and they're going to leave the profession, not just their jobs. And so they felt as if there wasn't a focus on retention because they were bringing all these travel nurses in and they were paying them huge amounts of money, but they weren't paying the nurses who were staying a reasonable wage. But I guess what I really wanted you to know is the KNA did a survey. We had over 800 nurses to respond to us. And that was a pretty good sample to give us ideas. And we developed a plan and we presented it to the legislature and we got no support for our plan. So I just want you to know that we did get the data, we analyzed the data, we did what the nurses asked us to do, but we didn't get any support at that time.
Delanor, if I would love to see if you have those results maybe on a spreadsheet and what your suggestions were. I would imagine you were suggesting those things in 2022. I wasn't there, or in 21. I'd love to see that.
I will be glad to share. I can either bring it with me or I can send it to you in email.
Sure. How about both?
Very good.
Things get lost in my email.
Okay. Absolutely.
All right. Well, thank you guys so much.
Thank you.
And thank you for the questions.
Delanor, do we have any questions from the audience?
We do not at this time.
Well, I might just ad lib if that's okay.
Please.
To a couple of the senators. I am just curious of what your perspective is on KNA within the healthcare policy realm, and how are we doing? What can we improve? What can we do better?
I'll be happy to start on that one since I think Senator Berg went first on the last one. I will flag in about 8 minutes. I have to hop off. So I've got a little bit time to go, but so I'm new to Frankfurt. I arrived via special election right in the middle of session. But since I've been there, you all have been sort of a constant and helpful presence. I've seen you testify several times in health services and gotten handouts with statistics and all kinds of information. And so I'm aware and sort of have this understanding of like, you all do good work, you have good data, and you work with us collaboratively. And when we're talking about healthcare issues, you are at the table as you should be. And so that's just sort of a newcomer's perspective. But very quickly after arriving in Frankfurt, I was like, aha. Unsurprisingly, the nurses knew what was going on and how to make sure to advocate for themselves and for their patients. And I've been very grateful for all of the help that you all have provided so far.
Thank you.
Great. Thank you.
And I will jump in there if it's okay and say, I think you all are making your presence well known. Because for us as legislators, I think the most important thing is to know when you have a question, when you need information, when you need something, who do you reach? Who do you go to? And I feel very comfortable that I know who to reach out to and that I know what the message is. And it's a strong, uniform message. And I think y'all are doing a great job.
Well, we appreciate everything you all do for us. And if there's things that we can do for you, if there's ever information that you need, you have questions about anything dealing in the realm of healthcare and nursing, please don't hesitate to let us know. And we're happy to get you data, any other information you need, and anecdotal information as to what actually happens in Kentucky on the ground. Data says a lot, but sometimes it's those stories of people on the front line that, as Senator Berg knows, when she's on the front line, those are the real stories where the rubber meets the road.
Absolutely. Well, if there are no questions in the chat box, except one person wanted to know how he could get credit for attending. And he said that this town hall was very informational and that he learned a lot. So if you'll just email me at ceo@kentucky-nurses.org, I believe I can help you out.
Well, if we did not have any other questions, I'd like to thank each and every one of you all that took times out of your evening and afternoons to join us today. We look forward to more dialogue and more creative, innovative ways to not only preserve, in my opinion, the best profession in the world, the most trusted profession in the world, but to ensure that Kentuckians are very well taken care of. Our next town hall will be next Thursday on September 14th at 6 p.m. if anybody would like to join us.
And for those people who are attendees, I would also like to invite you to attend our business meeting on October the 26th. It's from 5 to 7:30. You can just go to our website to sign up so that you can get the link. And our conference is November the 3rd. It is a virtual conference, and it's for 6 continuing education units. Thank you, everyone, for joining us tonight, and we look forward to seeing you again. A special thank you to Renee Cecil and the River City chapter for being the host for the very first town hall for the 2023-2024 legislative session. Well, I am now recording, so if we want to do any more questions and answers, we will have that in addition to what we already have.
And is Julie on as well?
She is. I see her.
Hello.
I see her.
Hey, she's
How are you all?
Were you
We are
flying a
doing
helicopter
great.
on the way over?
Okay, I'm sorry. I had technology issues too. The first one took me to like a Teams meeting and I had to download something. And I'm like, and then it said, you're the only one on the call.
That's a hint.
So I'm sorry, I'm late.
No, it's quite all right. We just appreciate you getting on with us and wanting to talk to the Kentucky Nurses Association.
Yeah.
Well,
Sure.
just to catch you guys up to speed, and then I'll give you all a quick minute to talk on each of our issues. We thanked everybody for our support within House Bill 176 and House Bill 200, the Workplace Safety Violence Bill, as well as the Healthcare Workforce Shortage Bill. And this year we laid out 2 legislative priorities. One of which was the decriminalization of healthcare errors. A few states, nurses, and healthcare providers, including physicians, have been criminally charged for medical errors. And we just kind of want to prevent that within our state. We don't want folks entering the profession, the most trusted profession, nursing, to be deterred by the ability to be criminally charged. And Representative Jason Nemeth will be sponsoring that bill. Our second bill within our legislative priority for the 2024 session is safe staffing committees within our facilities. We're not talking about ratios. We want to make that clear. So it's not speaking on ratios. Instead, we want a nurse-driven, nurse-focused committees within facilities that take into account patient acuity and need, as well as some other factors. Stress and burnout are really big in nursing and lead to people leaving the profession. This bill kind of gives them a voice in decision making and with regard to safe staffing, and enables them to better care for their patients. It's just kind of another tool within our toolbox of nursing retention. Our big issues and focus are the nursing shortage and crisis within our state and nationally. So a couple questions that we ask, and if you all could quickly hit on these, are what issues do you see in healthcare related to nursing, and how do you think these should be addressed? I'm going to kind of ask a multifocal question. So, what issues do you see in healthcare related specifically to nursing? How do you think these should be addressed? And then the nursing shortage is critical in Kentucky as well as nationally. So what additional measures do you believe that we can do to make sure that our constituents within the state are taken care of?
I'm going to defer to my colleague first.
Well, sure, I'll be happy to go first. You know, when you were talking about the bill where you can't be held liable for any errors, you know, that we've been hearing a lot about that in kind of the healthcare space in totality. You know, I've had a lot of inquiries from you know, people, social workers, and people who are providers in the child welfare space, people who work in the criminal justice space with you know, a whole host of medical issues, some more acute than others, but they're all very concerned about that same issue. And so a lot of people are talking about it, and I think that you're going to find really broad support on that, because otherwise it's just going to increase or diminish that workforce capacity that we're so desperate to ratchet up. So I'm a big fan of kind of figuring out what the right language is there so that we don't diminish our workforce any further. And then the only other thing that I will talk about is, you know, we're going to continue to struggle with MDs in this state. And so we're going to have to be creative about how we cultivate our nursing workforce, because I just feel like they are our frontline providers. And so anything that you all can think of and how I can support you in that, I'm all for it, because we just are lacking in primary care. We just have to do a better job of cultivating more frontline access to healthcare. So thank you. And I'm glad to be on. I'm glad to finally get on with you all. So thanks.
I'm glad you made it.
Senator Neal?
As to myself, I think my colleague, Senator Adams, Rocky Adams, said it very well. I think I'm open to revisiting that issue. I guess it's a balance between accountability and frivolous circumstances where you have situations that are not exact. It's easy to make mistakes in that kind of environment. There are other things that are contributory to outcomes that may not be factored in. So there's a lot of exposure, potential exposure there. And we don't want that to be something that works against those coming into the profession. So I think that's something that should be revisited. I think Senator Adams, Rocky Adams, said it correct, finding the right language to deal with the balance between those two things that I'm talking about, accountability, as well as not being a deterrent to those coming into the industry is very important. I want to point out, if I can switch just a little bit, you know, my sister was a registered RN for over 40 years. She's no longer with us, so I sort of came up with a nurse who always told me to drink plenty of water. You know, used to worry me to death about drinking water. But I got to tell you, I did not really appreciate what a nurse was about until I was in a hospital for 8 days with COVID early on, and the way I was handled and that was done. I think a lot of people who don't have that frontline contact that way, you know, they just come in, do some outpatient, something like that, really do not see how important and how valuable that was. Those nurses literally pulled me through. The doctor clearly was doing his job, but those nurses are doing. And I think nurses do not, the brand of the nurses is sort of taken for granted on a certain level. And I think promoting nurses and putting them on front lines and really being proactive in that area is very important for going forward. And that also includes dealing with the shortage of nurses as well. So I didn't mean to go off, but I always tell that story And I always try to address that because I cannot tell you, and those that are out there, how important a nurse's engagement is. And I thought Dellen Manson hears me talk about this all the time. So she knows what it's about in terms of where I'm coming from. So I don't know if I answered all your questions, but I'm still available to go more.
Great. Thank you so much. And we're so glad you got unmuted.
It was a miracle of some sort.
Do we have time for one more question or no?
You do. Please.
We do. Okay. So based on the Kentucky Nurses Association priorities of decriminalization of medical errors and safe staffing committees, what are your thoughts on these, or do you have any questions for us? And if you don't have any thoughts or perspective on that, then I'd like to ask, how are we doing at the Capitol? Where do you see KNA in regards to healthcare policy, and what can we do better?
Well,
You know, I think, well, first of all, I want to revisit the issue of the staffing, because I think I think one of the obstacles that you all are going to face relative to staffing is that everybody thinks it's that cookie cutter approach, that you're just going to throw out a number and then the number is fine and that's what's going to be. And so I think that the way you talk about it is on this Zoom has been very enlightening and educational. And so I would encourage you all to reach out and do just that, so that no one marginalizes your position before you even get ginned up and started. So that I think that's really key, is not to be marginalized, because that's not what you think you're talking about is not what you're talking about. And then second of all, I think that you're great at the Capitol, because I think that your lobbyist is the most fabulous woman.
Well, we do agree.
We do agree.
Thank you, Julie.
If I chime in there, if I may, let me tell you, it really gets down to the basics. First of all, I think you have a very positive image, again, for the same reasons that have been said here. You got an experienced person interfacing with us. She knows how to move, what to do, and we know her. But I do want to point out that it really gets down to the basics. You know, it's about engagement. And being strategically engaged is important. So the messaging that you provide, simple and straight, but comprehensive and very focused, is very important. But it's a matter of coming back again and again in very creative ways sometimes, but being straightforward and staying positive and persistent, I think, is key. And it's what I just said was very, very, very basic to lobbying, you know, in the areas where we operate. But we deal with so many issues. At the time, it's going to be very important, as you're doing here, to start early and really making sure that leadership is engaged in a very positive way and in a way that's enhances their understanding of the ongoing issues that nurses face.
Thank you. You're so kind, both of you. Julie, I was curious, or Senator Rocky Adams, I was curious, does Skipper have any comments to make?
I'm good.
Would you like to introduce your dog?
I know. Look,
I was about to ask, what kind of dog is that?
That's just
okay, but hold on. You all have to see. Hold on. Let me put Birdie down. Come on, you have to get down. She's terrified.
Brody.
She's terrified of the puppy. Let me see if I can get the puppy up here. Hold on. Come here. I want to show you. Look, here's the puppy.
Oh, no.
I'll do that again.
We call him the terrorist.
Oh, Lord.
But yeah,
Lord.
so that's Birdie and then Skipper.
Aw.
sounds great. That's just great.
Do you all
For
have any
fun.
questions of us? Is there anything you need to know from us at this time? Because we will be reaching back out again.
Sure.
We do have language. Jason Nemus does have language for the decrim. And we do have a bill that's hopefully tomorrow I'll get that language from the drafter on safe staffing.
Good.
That's all I would need. I would need to see what you have and what research, what other areas are dealing with this issue, and then the rest, of course, we'll do some research on that and dig into it and get back with you.
Well, and we're going to meet with KHA and KHCF, Leading Age. We want to meet with those folks because we do want them on board with us. If this isn't, we're just going to go out and do this solo. We want them on board because it behooves them to have safe staffing. And, Senator Berg had asked, why aren't you doing ratios? Well, it's sort of like the nursing homes and the situation at the federal level right now where the staffing mandates are coming down, but they don't have the staff to do the mandates. So it would be the same, that's one of the reasons we're staying away from that as well, is because you can't have ratios if you don't have enough people to actually fill those jobs. And we don't want to have to be shutting down hospital wings and floors or wards or whatever, or nursing homes or wherever. So, so we appreciate your all's openness and your help. You both have always been great friends to KNA, and we just want you to know how much we appreciate you.
I do have a question, if I may.
Sure.
The relationship between doctors and nurses. Yes. I've always wondered about that because doctors, as you know better than I do, function a certain sort of way. Or maybe it's not the doctors, maybe it's the administration of hospitals in terms of meeting your needs in the workplace in relationship to what they expect you to do and how that challenges the quality of your experience in the workplace itself. Is that being addressed aggressively and thoughtfully from the administrative standpoint internally in hospitals generally?
I'm going to start the answer, and I know that April and Dolores will jump in. But what I want to say is the nursing profession we're behind in how people think about us and what we do. I wouldn't say it's a doctor-nurse issue. I would say it's a nurse issue. And the nurse issue is that many people do not value nurses because they think we're angels of mercy. We have big hearts. They do not realize the expertise it takes to be a nurse. And it's because as nurses, we haven't been putting that information out. When someone says, oh, you're so caring, I am, but let me tell you what it took for me to be able to take care of your father or to even be able to take care of you. Many times nurses won't say all the things that they've done to assess, to make sure that you're getting what you actually need. We just go in, we get it done, but we don't tell people about it. So we as nurses need to start working on our image and be able to share that information so that people realize that, most people don't realize that the average nurse has 7 years of education. 7. So why aren't we acting like we have 7 years of education as we are talking about what we've been able to do to keep patients safe, to do a good assessment so that they get the right medication or the right therapy or the right consultation? I mean, all those things that we do to make a difference, we just don't tell people what we do. So
well, again, I'm sorry, I didn't mean to cut you off. But this gets back to my perspective on fact-based branding. Yes. Is a very important piece for nurses. And that was part of what I was talking about, the value and the skill. And I wouldn't play off that angel mercy stuff because I'm going to tell you something. It gets very personal and it gets very real. And I think that what they did, I'm telling you, nurses, I will say, literally saved my life at that time. And I don't think that's an overstatement. And just one thing I want to share. One nurse, literally, because another nurse shared it with me, said there was another nurse that was coming back on her day off checking my chart. Now, what's that about? Because I was her patient and she was so attached to trying to get a good outcome. She was doing more than just coming in the room and, sticking something in my arm or something like that. So I just want to share that because I am very high on nurses.
Well, I want to add 2 things and then I'll let somebody else talk. I'm not saying that we aren't caring, but we're caring and we want to be caring, but there is more to what we do than just care. Like the nurse who came back to look at that chart, she was looking at lab values. She's looking at many other things that tell her what's going on with the patient. Most people don't realize that nurses even do that. And then when they see that there's a problem, they make sure that the patient gets what they need, whether it's a consultation with Dr. X, or maybe they need to get blood. So they call and talk about what they saw in the lab works. My point is caring and.
Yeah, I agree.
You know, I'd like to elaborate a little bit on that, Delanora. You said that perfectly, caring and. I'm an advanced practice registered nurse. I went to school for a very long time. I practice in the same capacity as my anesthesiologist counterparts. Yesterday, I had a very difficult case on a lady that I thought was having an MI or a heart attack. And today, do you know what I was doing? Not there. I didn't work at that hospital today. I was at an eye center in another city, but I was checking on her labs and I was calling the family. I was asking how this lady was. So it is caring but there is a level of care I think goes above and beyond anything that is taught in medical school. We as nurses provide a specific care and a specific realm of care to our patients that physicians can't provide. And I'm not taking anything away from physicians. Please don't misunderstand me. But I think we go above and beyond and we care. And you said that very well, Delanor. And there's not a discrepancy or difference or fighting match between nurses and physicians because it is a healthcare team and we are both very, very, very important to the patients and constituents of Kentucky. But we care and.
We have a
Well
broad
said.
perspective.
Well said.
And I think one of the things when I talk about care and, that includes making sure that how is the family managing this situation? Nurses are going to be looking at all of those social determinants of health. You know, what's it going to look like when you go home? Do you have what you need in order to continue with your recovery? It's caring and is what we do. And Dolores, I know you're chomping at the bit, so go ahead and do your thing.
Well, I won't go on too much because this is a passion of mine.
I know.
But you two covered it beautifully. And Senator Neal, you were absolutely correct when you said the brand image, because that's what we are working on. And, you know, our theme for the year is there is no healthcare without nurses and all nurses are leaders. And we just need to help the public understand that, because they see what's in the media and on TV, and it does not accurately portray what we do, all of the behind the scenes things that we do every day for every patient. So we are working on it. It's just going to take a little time to get us there.
Very good.
Okay, we are at 7:24, and we have had an excellent second session, may I say.
Thank you both.
I really appreciate you guys coming and staying with us and answering questions. And I want to say thank you for your support for last legislative session too. I know that April said it, but I want to say it as well. We could not have done it without your support.
Well, you're awesome. Thanks for being such good partners with us for making good policy. So I appreciate it. And Julie, I'll be looking forward to hearing from you again so we can get going on this.
You will hear from me. You can run, but you can't hide.
I love it. I love it.
Too.
All right.
Thank you.
Bye-bye, everybody.
Take care.
Bye-bye.
Bye-bye.